Hi, I'm Dr. Rajat Kandhari, Director at Vaya Aesthetics, and we are here to dispel all your doubts and your concerns related to your skin, aesthetic, as well as dental needs. Today we're going to be discussing the issues related with soft tissue fillers. First and foremost, soft tissue fillers, also commonly known as dermal fillers, a word which is actually a misnomer because these fillers are not really injected into the dermis per se, but they are injected at various levels of the skin, below the skin or just above the bone. I'm going to be discussing some of the common issues in practice which we face and are covered and asked to me by my patients. Firstly, what are soft tissue fillers? So soft tissue fillers are essentially made up of hyaluronic acid. These are the popular fillers that we use today. Hyaluronic acid is a sugar which is present in your body, giving it tensile strength, integrity, and maintaining its elasticity, right? And once this hyaluronic acid is synthesized, it leads to a longer half-life, which means it persists in your skin for longer, doing its magic, which means hydrating your skin, making it beautiful and supple, giving it contour, giving it shape and integrity. Secondly, where can I use these fillers? You can use them. Typically, these fillers are used for the face. They also can be used for rejuvenating the hand, for uplifting the breast, and for other areas. But typically on the face, we can use them in the upper face, the mid face, or the lower face. Commonly, they are used for laugh lines. As you can see in my face, the tear trough, the lines around the corner of the mouth, for giving your chin structure and integrity, for giving a lift to the face, as well as giving your cheek the apple or a contoured cheek, as we can see in many individuals. In men as well as women, we can also use it to shape the lower face and give a chiseled, more sophisticated looking jawline. So you must be thinking, how do we go about doing this procedure? How do I get into it? So the procedure is typically an injectable procedure. While your apprehension is understandable that it might be painful, these fillers are typically made with local anesthetic in them. So for most patients, the procedure is very, very comfortable. Also, in the hands of a skilled practitioner who knows their use with needles as well as with blunt cannulas, which are used commonly to do this procedure, pain is almost a negligible factor. How long do the results of these fillers last? This is a very, very common question asked to me. Do I need to get them repeatedly? I'll have to keep getting them done. Well, the results last depending on the area that we treat, as well as the kind of filler that we used. There are different kinds of fillers. Some which help in only hydrating the skin when we put them in the skin. Some which are put little below the skin. These give structure and integrity. Some which are put just above the bone. So these give volume and support to your face. The deeper the filler, the more robust the filler, the longer it will last. Typically, a lighter filler which is put up in the skin lasts just for 6 to 9 months, and you need to get a top up right after that. But a heavier filler which is put just above the bone, much deeper in your skin, can last almost up to 2 years. So you're pretty safe out there. Doc, what if I don't like the results of this treatment? Well, the good news is that this treatment involves dissolution of the filler. That means if you don't like the results, we can reverse them. And this is what makes hyaluronic acid fillers so popular worldwide. I hope this video helped clear some of your doubts regarding hyaluronic acid filler treatments. I urge all of you to visit a skilled dermatologist for this treatment, as each face requires an individualized plan. While the idea is to make you look younger and fresher, but at the same time preserve the grace of your face.